¿Cómo hacer comunidad? En una población que es bastante difícil para la mayoría de las personas, pero que necesitan de todo nuestro amor, nuestra compasión y romper los estigmas que la rodean. Esto es Punto de Encuentro y hoy compartiremos una de las secciones que ha realizado la ciudad de Palm Beach con el Behavioral Health Commission. Vamos a hablar de hacer comunidad a través de una gran organización de Recovery Community. Así que no te lo pierdas porque esto es Punto de Encuentro.
Punto de Encuentro con Alba Acevedo. Un espacio para compartir en familia, reír, aprender y mucho más. Punto de Encuentro.
Good afternoon, everyone, and welcome to our Eat, Learn, Save, the Opioid Overdose Prevention webinar series. This webinar series is presented by the Palm Beach County Behavioral Health Coalition in partnership with the Health Council of Southeast Florida. This initiative is part of the Overdose Data Action Grant and is designed to provide education, tools, and resources on opioid overdose prevention, harm reduction, stigma reduction, and community-based support. All webinars are free and open to the community. Before we begin, just a few reminders. This session is recorded and the recording will be shared. Closed captions are available if needed. Certificate of attendance are available at no cost. Please use your chat to ask any questions, and towards the end, we will give the presenter and the agency an opportunity to answer any questions. Today's topic is how do you build community? Today's presentation will be presented by Holly Stewart, who is an LCSW, and she is the Executive Director of the Recovery Community Hub of Palm Beach County. Today's presentation focuses a lot on building community. While technology keeps us connected, many people continue to experience loneliness and isolation. In today's topic, you will learn things like, exploring connection and belonging, how it matters in recovery, practical ways to build stronger, more resilient communities, how mutual support and shared responsibility help people thrive. Thank you guys so much for being here, and we're going to get started with Holly Stewart. Thank you guys.
Welcome to today's Eat, Learn, and Save webinar. I want to thank the Palm Beach County Substance Abuse Coalition for allowing me to present today. I want to be discussing ways of building a sense of community. Research indicates that a strong sense of community is a fundamental human motivation essential for well-being. CDC recognized the powerful role of social connection in preventing serious illness and promoting overall health. Some of the core benefits of a strong sense of community includes mental well-being. Belonging to a group lowers the reporting of stress, depression, and anxiety. And research demonstrates that community bonds provide both social and emotional and practical support during times of crisis. Social isolation carries health risks comparable to smoking or obesity in terms of physical health. It's the leading predictor of lifespan and life satisfaction for older adults. It provides people a sense of purpose and identity. Community engagement gives individuals a sense of meaningful daily life participation and connections anchoring individuals' identity and validation. Community also fosters neighborhoods that are more interconnected. Think environments of familiar strangers and shared resources, which naturally increase trust and daily happiness. I'm Holly Stewart, a licensed clinical social worker, and I've been working in the social service field here in Palm Beach County for 25 years in a variety of settings, from home visiting with families to residential settings to being the executive director of the Recovery Community Hub of Palm Beach County. What is the Hub? The Hub is a recovery-centered organization. These are organizations led by people in recovery for people in recovery. Peer support is critical to their success. They develop from identification of community needs. They're neighborhood drop-in centers. You don't require an appointment. And anybody who identifies as being in recovery for either 20 minutes or 20 years qualifies for services. The Hub started in 2021 in Delray Beach with the first recovery center, and that's the actual physical and brick and mortar building where we have a drop-in space. It's kind of like, think a YMCA or a JCC. It's a community center developed by the recovery community to meet their particular needs. We do everything from offering connections to resources. We provide educational programs. We have social events. We have a cornhole event coming up this week in our Lake Worth Hub. We also have all recovery meetings. So there's a variety of services offered. In 2023, we expanded from the Delray Beach site to Lake Worth. So we have an office right in downtown Lake Worth. That's sort of the center of our social events. That particular community has decided that game night, open mic nights, cornhole is important to them. Our third site opened in Belglade in April of 2025. It's a very underserved population, so we have a site on Dr. Martin Luther King Drive East, not far from the Glades Initiative and near the bank of Belglade. And finally, our fourth site, which I consider a flagship site, the River Beach site, opened in April of this year. So I want to talk about peer-based recovery. One of the things that recovery centers offer is recovery coaching from trained peers. So these are individuals who have lived experience in addiction, or like myself, have a family member who is substance abuse impacted. And we really are going beyond harm reduction. We are looking for individuals to make progress towards their goals. Peers use real life experience to provide support and guidance, and that's part of the building of communities. We don't provide any clinical services. I am an LCSW, but I don't do anything clinical there. This space is meant to be inviting, welcoming, safe, and non-judgmental. It means that we have to have a space for people to come in, even if all they want to do is have a cup of coffee and be in a space where they're not exposed to substances. We also provide resources, and we connect to other services with similar styles of engagement. We have, for example, we have a health clinic, Access Health, that likes to come in, and what they do is they will actually go out in the community, bring them in, they provide food. It's a fun atmosphere. We provide music. It's almost like every Friday they come to the Riviera Beach Hub. It's a party. And as part of that, they're talking to people about their health. They're helping them get connected to resources. They're offering STD testing. They'll do a full CBC panel. And people don't have to have insurance. But the idea is that people come in and that they are greeted with warmth and welcoming, regardless of where they're at. Now, we ask that people not come in while they are currently under the influence, but that's really the biggest demand that we ask of them when they're first coming in. Now, obviously, part of that is developing that relationship with them by using this safe space. So we have friends of the hubs that are volunteers who are people who are farther along in the recovery. Many of them are participants in our recovery academy, and they are really view this as their space. They take ownership of it. They will come in, and if they see something is not being taken care of, They will go in and clean up spilled coffee and then redirect the person who spilled it to clean up. They will lead the groups that we do, all recovery groups. I've even had a participant who came in and was very, very upset. She was very despondent. She was just having a really hard time. And one of our volunteers sat with her and just listened and gave her space. That's all she needed. And then as we were working on getting this woman who was just despondent connected with some mental health resources and some food stamps and it got to be lunchtime. And our volunteer, our friend of the hub, said, hey, I happen to know that there is a place that does free lunches just down the street. And the food on Wednesdays is really good. Why don't you and I walk together and we'll go have lunch together? And that gave this woman time and space to be supported and welcomed. And that's kind of what we're talking about, is as a community, we're bringing people into the center, but it's not just the staff that are driving services. It is the volunteers getting involved. I'll give you another example. We have a long-term person in recovery that comes in and volunteers at the hub of Delray. And one of the things he noticed is that a lot of individuals need assistance in seeking employment, getting sustainable employment, getting away from working the minimum wage job at Burger King, which we all know is not enough to pay the bills. So he's an accomplished gentleman himself. He put together a 3-week series on career preparation and employment preparation that included everything from resume building to getting the interview to how do you perform in the interview. And it was so well received. He's going to be doing that series again, but he's been asked to add a section on financial planning, because once you get a job, then you have to be able to then budget. And this was his idea. Now, our volunteers are trained, they are vetted, they are background checks, but we have other volunteers that maybe couldn't pass the background check, but still will come in and they will do everything from, in Riviera Beach, we have a gentleman that for some reason just wants to make sure that all the floors in the bathrooms are clean. So we let him do it because that's how he feels that he can give back to the community and support others. So building this neighborhood-based approach, clients start to begin to self-regulate, and they reinforce the center's culture on their own because they feel invested in the center. Just recently, we had an incident where there was a client who was falling asleep, which isn't really allowed in the center. And one of the other clients said, hey, you can't take a nap here. You can sit, you can have coffee, you can work on the computers, but this is not a homeless shelter. And sure enough, that gentleman said, oh, I'm so sorry. And then he got up and started doing something with another volunteer. They started talking and actually ended up having their own miniature little recovery group related to faith in recovery. We've had clients help set up chairs, all kinds of different things, because they view this as a safe space to support each other. And it's really quite amazing and wonderful and beautiful to watch. Our goal, how I really see the hubs developing as time goes on, is we really want to develop these resilient, recovery-ready communities. So research separates resilient communities and recovery-ready communities. So think about this in terms of communities that are intentionally designed to adapt, withstand, and rapidly respond and bounce back from catastrophic events at the community level. Think hurricanes. But I also see it important as integration at the individual level, whether that is a house fire in the American Red Cross response, or an individual has a mental health crisis, or that we can help respond to individual relapse, job loss, eviction notices. That's how I see the tie together between the resilient community and the recovery ready community. We're already in a position where the hub, right after it was formed, had to respond to COVID. We're already working on how we respond to heat waves, if by nothing more than opening up our organization and providing AC and cold water to the clients who were coming in. We worked with Palm Beach County during the cold spells to make sure that our homeless individuals had a safe place to be. This is all really, really important. Please understand that of the people we serve, 31% are unemployed, 19% have been employed less than 3 months. And for many of those, we have helped get them jobs. 22% have a high school diploma or GED. Interestingly enough, only 6.5% of our clients did not graduate or have a GED. Most individuals, when they think of somebody with a substance abuse or behavioral health mental disorder, they think of individuals who are not well educated. That's not true. 41% of our clients earn less than $30,000 a year. 45% report they're single, divorced, or separated. And many report that they have one or fewer friends. 18% are homeless, and about 3% are at least currently at risk for losing their housing. 21% of our clients have only been housed less than 3 months. And quite a few of them, when you look, they have had numerous addresses. 24% that they're at risk of homelessness, and 66% have a current or history of legal issues. That's actually gone down. We're starting to bring in more individuals who are longer in recovery and earlier. We're providing interventions earlier to individuals before they've had a history of legal issues. And I'll talk later more about how we do this. So when we're talking about recovery-ready communities specifically, please remember treatment is only the first step, and hubs are only a small piece of this puzzle. When I talk about recovery-ready communities, this is something that we need your help to develop. It is a community environment that actively supports individuals in managing their substance use disorders and recovering from substance use by offering a seamless continuum of care, employment, and social acceptance. We don't want to focus on punishment or stigma. Instead, as a broader community, we're trying to prioritize healing. We're trying to provide resources necessary for individuals to build healthy, lifelong recovery. Genuinely recovery-ready communities function as kind of an interconnected ecosystem, and they feature quite a few of the core elements. So there needs to be accessible, diverse treatment and support. And that means a full continuum of care. I'm not just talking about 30, 60, 90 days residential treatment, although we do have programs that can go as long as 6 months. We're also talking about intensive outpatient therapy, regular outpatient therapy. We need to make sure that people have access to medication-assisted treatment for both substance use and behavioral health disorders. We need our, recovery centers. We need recovery organizations. We need support groups, and not just AA and NA. Many individuals at the hub, we believe that there are many, many paths to recovery. People can go to SMART groups. We have all recovery groups. There are lots of different ways to get there. It's really important for individuals in recovery that they have safe and stable housing. We understand that this is a challenge in Palm Beach County. In addition to sober homes, we need affordable workforce housing. We need housing for individuals with behavioral disorders that need additional support, like what's available with integrated healthcare. Our clients need access to employment and education, which means they need access to second chance and fair employment sites. There are a number of organizations, companies that are even led by people in recovery that are recovery-friendly employers. We actually assisted one client in getting employed, and after about 2 months, he really started to struggle. And one morning, he picked up the phone and called his boss and said, "I think I'm going to relapse, and I don't know what to do." And his boss said, "Remember those people who helped you get the job? Go back to the hub." The client did. And we were able to give him some support, some stability. He met with his recovery peer, and he ended up going back to work the next day. And his employer made room that he could go to all recovery groups, that he could go to AA and NA. And by the time the gentleman had been employed there 4 months, he'd been promoted. And that business has reached out to us because they had so much success that they want to employ another one of our clients. We need peer-led spaces. Good examples of this, the Hub, but also we have Rebel Recovery. They're another RCO. They are more of a street-level intervention that does a lot of work with harm reduction. We need AA and NA. We need sites like Crossroads that sponsors a lot of AA and NA groups. We also need family support. The families of individuals in recovery need just as much support as the individual themselves. Usually when you have somebody who has significant mental health disorders and substance abuse disorders, the family reorganizes itself and its behavior around that person. So we need to provide just as much support for our families. Currently in one of our sites, we have a brother and sister that are really going through the recovery process together, even though the brother has no history of substance use. But they are connecting, they go to family therapy together, and the brother is starting to realize and understand that he now needs to reorganize some of his thought processes, his life, and change his relationship with his sister in a way that supports her, but also doesn't enable her. We also need to talk about active anti-stigma campaigns. This is something that we need all of your assistance with. If you want to hear more about this, there is this great document. It's called Building Communities of Recovery. You can Google it. We'll make sure that that's available to you. But the entire purpose of all of these services is for all of us, even those of you who have nothing to do with the recovery community. You still have people in your places of employment who may be in recovery or may be struggling with mental health or substance use issues. The people that you see in Publix, your neighbors. We need everybody's help with this, because what we're trying to do is we're trying to build a community with recovery capital, and that they have all of that inherent in our community. Now let's talk about, this is that document that I mentioned, the Building Communities of Recovery. It's written by Mike Tyson. It's a great document. It's very easy reading. So I just wanted to show this to you so that if you wanted to access it, you can. When we're talking about recovery-ready communities, this is what I'm referring to. You're talking about social work providers. We're talking about our faith-based community, the recovery community, like the hubs, treatment providers, obviously, healthcare providers. One of the reasons that opioid addiction got so incredibly bad was because doctors and physicians were not aware of the impact that these very powerful opioids could have on their patients. And as a result, they were overprescribing. The other thing is that we need to do is educate our healthcare providers on the risk of older clients of developing substance abuse issues related to taking their pills. Not only can we end up with polypharmacy issues where different physicians are not aware that they're prescribing different medications, and because of insurance reasons, sometimes people end up getting medications from different pharmacies. But also older people metabolize the opioids much differently than they're younger, so we have to be aware of that. We need to start working with justice agencies. We currently have an advocate who goes to drug court. She's been invited to mental health court. She goes to family court. She's gone to first appearance, because just incarcerating an individual without offering access to recovery supportive services pretty much guarantees the person's going to be rearrested. We also need all of your social service providers to help us achieve all of these things. That is a recovery-ready community. This is another great resource for you. It's called the Recovery Ecosystem Index. You can Google it, and it will actually provide you an assessment at the county level. So this is actually Palm Beach County. So we have a number of substance abuse treatment facilities. We're actually rate higher in this category than both all of Florida and the United States. Their average distance to the nearest MAT provider is 3.6 miles, which is amazing. Now, unfortunately, if you do not have insurance, it's hard to get Medicaid-assisted therapy, but at least it's available. We have sufficient, we have pretty good mental health providers. We're better than the state, but we're still lower across the population. You'll notice that there are smart recovery meetings available. There has not been a Drug-Free Communities Coalition grant in this area, but I have a feeling that is because we do receive funding from the county in the opiate settlement dollars. We have a drug court. Unfortunately, it only meets 2 days a week in the afternoon. So unfortunately, if you have first appearance on a Tuesday, you may not have the option because you then would have to come back to court on the following Thursday. But at least we have one. And in Riviera Beach on Saturdays, they actually have a drug court that specializes in supporting families in doing a Marchman Act. So really, we're doing quite well in comparison with the state of Florida. Now let's switch to talking about what resilience hubs are. Resilient communities are groups of people and local systems that possess a sustained ability to prepare for and respond to recovery or adverse situations. Rather than simply bouncing back to normal, let's say after hurricane or after COVID, they proactively plan, adapt, innovate, and grow stronger despite chronic or acute stressors or shocks. So these are communities that minimize the disruption of disasters by relying on certain core characteristics. So again, all of this is built on that social connectedness and cohesion. So even if you're not in the recovery community, this is that resilience that I was talking about that we're all trying to work to develop together. We want to develop strong bonds of trust and mutual aid between neighbors at that neighborhood level. So, think about it. When you go out into your neighborhood, do you wave at people when you drive by? Do you know the names of your neighbors? Do you know their pets' names? Do you know their kids' names? Are their kids welcome to run through your yard? That's that social connectedness and cohesion that we want to kind of help people collectively identify, and it greatly improves how the community works together during crisis. I'll give you a great example of this. Actually, I'll talk a little bit more and then I'll give you the example. These are communities that have a reliable access to essential services. So this includes healthcare, safe, affordable housing, which we know is a challenge in Palm Beach County, communication networks. And we're not just talking cell phones. This includes, can you get access to news reports during a storm? Do you have access to emergency food supplies? You also, and I'm going to now talk about that example. So during the 2004 hurricane season, yes, I've been in the county this long, I lived on a street that did not have city water or sewer, and our street was not paved by the county. So we used to joke and say that, you'll know you're on the right road if it looks like you're in Baghdad because your car can disappear into a pothole. Yeah, that was my neighborhood. So during the 2004 hurricane season, what it means when you don't have sewer water, city water, or septic, it means that when the electricity goes out, your well pump turns off. And that's a problem. And we did not have a generator. So I had to use 5-gallon buckets to collect water to flush toilets from the rain. So what happened is I lived in a resilient community where people knew each other. My next door neighbor who had a generator ran a power cord over to mine. The neighbor across the street who also had a generator ran a power cord across the street to me because my husband, who worked at the Red Cross, was at the shelters all day and I was home with our 2 children who were very young at the time. I think they were about 3 and 7, very young. And they just did this without asking. They said, "Oh, you don't have a generator. We'll take care of it for you." And then one morning I walked out, and my husband and I had a beautiful gas grill. We made sure that we had propane. I walked out one morning, and there's a gentleman making coffee on my back porch. No, he was cooking bacon, and he was about to cook eggs on my back porch. And I looked at him, and him looked at me, and I said, "Well, here's the kettle. Please put it on the fire, and we'll have coffee together." Turns out he was the son of the fireman that lived 3 doors down from me. And the fireman knew that we had a grill, and I'd given permission to use it. Then when my husband would come home from work every day, he would bring a thing of ice. Because if you worked at the Red Cross and you were there all day, at the end of the day, if there was ice left in the ice machine, you were allowed to bring some home for your family. So we were providing the ice for the neighborhood. That's an example of a resilient neighborhood. We got to know our neighbors really, really well. We got cut off because all the trees at the beginning of the street, we lived on a short street that was a dead end. The trees at the beginning of the street all fell down. And so we ended up closing the street down and having a private party for Halloween with a bonfire in my backyard. You know, these are the kinds of things that we want to teach people to develop in their local neighborhood. Now let's talk about some of the larger community things. We want to make sure that we have a good economic diversification. Now, thankfully, Palm Beach County doesn't have these issues, but there are some areas where there is a reliance on a single industry. I would talk about in the Glades, they're very reliant on agricultural community. So a really, really bad freeze or really, really bad infestation can really hurt that community, causing major economic downturns and even the loss of large employers. The other thing we can do as a much larger community, as opposed to that neighborhood level I was just talking about, is we want to be adaptable and have long-term planning. Now, we're very lucky. We have a very strong emergency response coalition here in our county that works hard to develop holistic, sustainable plans that can deal with acute shocks like natural disasters, but also long-term stressors. Climate change is really affecting our community now. A systemic inequity has shown up a lot in our community. So by understanding the dynamics of community resilience can be really beneficial because these frameworks can help us evaluate everything from our planning to public health. Now, there is a model for resilience hubs. And we at our community hub are moving towards this, some of this. So we do have community programs. Resilient hubs are open every day. They are not just open in times of a disaster like the emergency shelters are during the hurricanes and during the recent cold snaps. They also work on emergency preparedness. They provide readiness training, emergency supplies. Now, the hubs do have some supplies in terms of hygiene items and things like that, but we don't carry food or things like that. They also provide facility and site readiness. They have building upgrades, reliant energy sources. We unfortunately do not have that. We don't have access to a safe shelter and electric. But instead, to kind of meet this model, we partner with other community providers like the Salvation Army that did open shelters for the cold. Now, there are some things that the hub can do to contribute to developing these more resilient communities. We are a community-based location. We work really hard to nourish existing relationships and trust in the neighborhoods where we exist. We work really hard to help our community prepare. So as we go into the next hurricane season, we're talking to our members of our community about what they need to look like. And remember, all of this looks different. So what we do in Riviera Beach is very different from what we do in the Glades and in Delray. We do job training and recruitment. So there are some parts that we're able to do. We're trying to help collaborate with our emergency planners, and we want the community to be able to provide feedback on what is best for them. Because at the end of the day, neighbors and peers are usually better at communicating what they need and providing for one another, like I talked about in my neighborhood during the hurricane. So this gives you an idea of kind of example of a resilience hub. And you'll notice this is very, very similar to the EcoMech of the Recovery Ready I showed you. So it's, again, you're going to have other hubs connected. We have 4. I would, in this, also add Rebel Recovery as another local RCO. There's governmental agencies like our Palm Beach County who manages our emergency services. There's other community organizations like all of you. There's lifeline supports that really help. There's businesses that provide that economic stability, and also community members. So as you can tell, there's an enormous overlap between a recovery-ready community and a resilient community. And that's what we're trying to reinforce. And that's kind of the hub's part of contributing to everything that you are doing in the community. One of these important integrated systems is that we all have to rely on trauma-informed care. And there are different levels of trauma. All of you, I'm sure, are familiar with ACEs. These are these adverse childhood events. And the more adverse childhood events you experience early in life, the more likely you are as you age to have behavioral health issues, mental health issues, substance abuse issues. It's not a causal, it's correlational, because they're also protective factors that can prevent adverse childhood events from impacting you, but it's still a risk. There's also adverse life events. These are things that happen to us as adults. Could be violence, victimization, chronic stress, discrimination, inequities in our community. And then we can talk about ACEs. These are adverse community events. And that would be a good example of, that would be COVID, 9/11, hurricanes. And please remember that trauma can be primary or secondary. So primary would be a hurricane hits Palm Beach County. Secondary, I like to give the example of 9/11. During 9/11, those of us who were not even in New York really had this visceral response to that attack. And it was compounded because they kept showing the attack over and over and over again on local news stations. It was pretty much running continuously. That is an adverse community event that is primary. The secondary impact on me is that adverse life events, that repeated exposure to violence that was nowhere near me, but I still had that visceral response. Well, what we realized pretty quickly, but not quickly enough, is that those news shows were showing that in time over and over again, and children were watching. And children frequently do not understand that it's one event that is finished. So they're seeing planes shot from different angles, hitting buildings from different angles. And for young children, they were assuming it was happening over and over and over again. So that's a good example of secondary ACEs. So please understand, it's really, really important, and I know we harp on this a lot, that all of us receive good trauma-informed care training and recognize that trauma-informed care operates on 6 core principles to prevent re-traumatization and foster healings. We need to make sure that wherever you are operating, you as an individual, where you're going into homes, whether you're community-based, whether you're center-based, you want to make sure that those environments have physical and emotional safety. And I know that is really, really hard to do, especially if you're somebody who is meeting clients on the streets, in court. That is not an emotionally safe environment. If you are meeting individuals who are homeless, that can be challenging. If you're meeting women or men who are victims of domestic violence, it's very hard to provide that emotional safety, but it's really integral to care. We also have to be trustworthy and completely transparent. We need to build trust through honest communication and consistent community operations. If we say we're going to do something, we need to do it. But we also have to be honest about our limitations. We need to say, I'm sorry, I don't have the funding for that right now, and I don't know when it's going to come, without blaming. We just need to be honest about the limitations of what we can do. And that also extends to informed care. If you're going to have a resilient, recovery-ready community, you need to have honest conversations with individuals that include that if you are at risk to yourself or someone else, or if I have concerns that somebody of a vulnerable population, a child, a person with a disability, an elder, is being abused or neglected, I am going to report it. If I'm worried you're going to hurt yourself, I am going to call 911. As a licensed clinician, I can Baker Act you. And it's important to set that tone in the beginning so that individuals know limitations. To do it after the fact means you have just broken all of that trust that you worked so hard to develop. Our model is based really strongly on that peer support. We want individuals who have shared experiences to build trust and empowerment. Now, there are people in the room, I know, who are going, well, you don't need to be an addict to help somebody treat somebody for substance use. I agree with that. Our particular model heavily relies on peer support, however. Please remember, we are not clinical. We are not providing treatment. We are a peer support model. I also believe you do not have to have a mental health issue to treat individuals with mental and behavioral health issues. I will say, though, as a family member of a person who has substance abuse issues, that has been very helpful in drawing on that learned experience. Again, we're talking about a peer support model. There are other successful models out there. The other thing is, when you are trying to build this community within your organization, it really is about collaboration and mutuality. It is shared power and decision-making to level power dynamics. It cannot be a situation where I am the provider and I am telling you what is best for you. The nuanced side of that is also, as the provider, as a clinician, as a peer, we can't work harder for our clients than they are working for themselves. Because at the end of the day, they still have autonomy. And that is really, really hard. And I'll give you a great example. We had a client who would come in and we would say, how can we help your recovery today? And he would go, I'm not in recovery today. I'm just here. I just need a safe place to be. All right. So we would help him with his food stamps. We would invite him to recovery meetings. He wouldn't go. And this went on for a good 18 months. And one day he walked in and our peer specialist looked and said, how can I help your recovery today? And he looked the peer specialist in the eye and he goes, I'm ready today. Today's the day. We got him into treatment within 24 hours. And that's that collaboration and mutuality that I'm talking about. Did he need treatment earlier? Yes. Was he ready for it? No. So allowing people space to communicate their needs is really important. We have to empower our clients to have voice and to have choice, even when we don't agree with it. They need to have active participation in their care. So we do this by creating an IRP, an individual recovery plan, that helps that person identify what their goals are and identify the action steps they want to do and what order they want to do in it. So we have had a client come in and say, I just need a job. All right, we'll help you get a job. Why do you need a job? Well, I'm homeless. I got trespassed. I have outstanding court fees. We had to let him prioritize what he wanted to work on first on his IRP. And it's funny when you do that, sometimes you get to the simplest step. So I was working with a young lady who really wanted to get a job. She had 6 children. She needed childcare. She needed a lot. So I sat down and I said, okay, what do you need to get a job? She goes, well, I'm going to have to make a resume. All right. Have you ever worked before? Well, I had a couple jobs in high school, but I haven't worked since I've had my children. She started having children at 19. Okay. So what else do you think you need? Well, I'm going to have childcare. All right. What do you need to do to have childcare? Well, I can go to Workforce Alliance and I can get signed up and I know that they can help me if I go over and they'll do a resume. All right. So we walked through all the steps. And you know what we realized the first step she needed? She needed a clock. She needed an alarm clock that could do multiple alarms so that she could get up in the morning on time and schedule the alarm to warn her when she was going to have an appointment. And then she needed a calendar. So her first action steps to get that job actually had to do with developing some life skills around basic time management. We would have never gotten there had I not listened to her voice, let her make her own choices and figure out what was most important to her. And that also points out we have to have a strong connection with their individuals and understand their cultural, historical, gender, and what that means. We have to respect their background. We have to be aware of our implicit biases and assumptions. We have to be aware of what stereotypes we carry. And we have to be able to address intergenerational trauma to really be successfully provide trauma-informed care. So let's talk about how you actually go about building communities that are both resilient and recovery ready. These are 5 action steps that you can put together starting tomorrow. Now, you may look at this and think, I'm already doing a lot of these. Yes. And you don't have to do them in order. You just need to be aware of it. For many of you, this is going to be a refresher, but I like to talk about it this way because it really is, I know for me, I go in and out of the different strategies at different times. And they say if you have more than 3 priorities, you have no priorities. Well, unfortunately, in doing this, you have to hold 5 priorities at the same time to really, truly be successful. So you have to listen first. When the hubs got started, even before there were centers, they held listening sessions in the community where they asked people in Delray Beach, in Riviera Beach, in Belglade, in Lake Worth, what do you need? If we had a recovery hub, what would it look like? And then we identified some community champions. I love talking about Darcy, our fidelity coordinator. She's going to be answering questions later in this presentation. She started as a volunteer at one of the community meetings. She jokes that she started as a volunteer assembling furniture in our Lake Worth office. She then ended up joining the leadership team. Every hub is run by individuals from the recovery community in their neighborhood. She then went on to become a peer specialist. That's what I'm talking about, identifying who are those people in your community. Get them on an advisory, get them on your full board, have them provide information. You can conduct surveys. You can have measurement tools. Our leading measurement tool is called the RCI, the Recovery Capital Index. I'll talk more about that later. Do interviews. Just ask. We still constantly are incorporating things that our clients suggest. I used Lake Worth as an example earlier. We used to have a game night, very, very popular. They asked for an open mic night, so we started having an open mic night. Then we noticed game night was falling off, so we said, hey, how would you guys feel about a cornhole competition? Now we're having a cornhole competition. You have to ask, but then you also have to do what they said. There is nothing worse than somebody asking your opinion and then ignoring you. And that really breaks trust. Now, sometimes people will ask you to do the impossible. We want you to build a recovery village where individuals in recovery can come together and live and learn. Well, that's great. I, at this point, don't have the capacity to do that, but I'm willing to listen to your ideas and figure out at some point in the future, could I build a recovery village? The next thing is you have to remove barriers to access. One of my favorite sayings with my staff is my job is to get rid of the barriers that you have to getting the resources that your clients tell you they need. So first, you have to have a warm and welcoming space. When people come into the hub, we have water fountains, we have cold water bottles, we have free coffee, we have free Wi-Fi. We let people charge their phones. We let them use the computers. So we have TVs in the hubs with this nice little video showing. Sometimes we will use them to watch recovery-friendly shows or even recovery-based movies that we then talk about in groups. You also want to be careful that you're using supportive language. We talk about our clients, our participants. They're participating in our community. They're community members. I don't call them patients. I don't call them people with, I don't call them addicts. We don't call them people with issues. They're participants. You also have to be careful to put the person first. So it is a person who's been impacted by substance abuse. It's a person who has behavioral health issues. It is a person who is, or a family that's been impacted by the justice system or is participating in the justice system. I don't talk about addicts, I don't talk about criminals, and I don't call people crazy. And that's really important. And sometimes that can be very difficult. When we talk about our participants, we include the individuals, families, but we also talk about supporting the professionals in our community, because this work is hard. And if we're not here to support each other, then what are we really doing? If we can't support each other, we certainly cannot support our clients. We've worked very, very hard to make sure our neighborhoods are community-based and responsive to what that neighborhood needs, and that they are in walkable areas, they are near bus stops. We work really hard to try and do that. We are very fortunate that we have just recently gotten access to transportation. So we can actually get people started on the transportation disadvantage program and give them a month or two of free bus passes if they're going to treatment every day, like in an intensive outpatient, or they're employed, just to give them that time. We can even provide Ubers for medical appointments or for people to come to the hub to work on things with us. Now, we don't Uber people to grocery stores or to jobs. I mean, that's more of a long-term thing, but we can do that as well. We also use the community's Lyft program. The other thing is we also set clear expectations for our community, and our clients adopt that. And interestingly enough, that community expectation varies a little bit according to each hub, because each hub reflects that local community itself. And it's interesting, especially when we opened the Riviera Beach office, because it became very busy very quickly. And it was interesting to watch how quickly the clients themselves developed the community expectations. Now, for some of you, that's making the rules for group or setting the expectations as a professional if you're meeting with them individually, or having rules that you actually have up. We do have community expectations that we post that are the same for all of our hubs. But in addition to that, our clients set that warmth and that engagement, and each one of the hubs has very different feel as a result. It's kind of cool. We also really want to empower multiple leaders. So I joke all the time. People are like, oh, you're the executive director. I'm like, yes, my job is to go exactly where my staff tells me to and exactly what they tell me to. And that's exactly how it works. So we have peer support specialists, again, individuals with lived experience. We have our volunteers, our friends of the hub. We frequently go to them to get their opinions and to help organize things. We also have those community-based leadership teams. They help the peer specialists develop what the programming is going to be for the next month or two. And then that information gets rolled up every month to our board of directors. And they're the ones who set the longer term vision. But all of that really is based in that what the community needs. It's very, very helpful that across the board, we kind of have a flat hierarchy structure. I personally use the servant leadership style because this is very helpful, and we really have this bottom-up communication structure. So this is, again, one of the things that you can take back to your community and your organization to help build community around whatever services that you're providing. It's really important that we collaborate and partner. The reason we call ourselves the hubs is we imagine ourselves as literally the center of a wheel. And we connect with all of these folks. So we have an organization that comes in that helps with health insurance. We participate in the Recovery Housing Initiative ourselves, which allows us to place somebody in sober homes while they're seeking sustainable employment that will allow them to either stay in the sober home and pay their own rent if they continue to need that sort of stability and support, or save enough money that they can move out into their own apartment. We also work with housing providers, the HOT team, integrated healthcare systems. We work with, the Lewis Center and all of those. We talked about transportation. We provide job assistance, but we're also reliant on employers. We provide education in-house. I'll talk more about that later. But we also connect to our local colleges. Obviously, treatment providers are very, very important in our area. And not just the reason you see treatment twice is because they were 2 lines that didn't fit in the graphic. So it's not just residential treatment or inpatient treatment. I have treatment twice there because for a lot of individuals, they may only need outpatient therapy if they've been in recovery a while and they're just having an immediate crisis in their life that they need that additional support. So you'll see all of these things need to come together. And that's why we have so many partners coming into our hub. If you look at the calendar on our website, you will see activities almost every day of the week with different providers coming in. We can't provide clinical services, but we certainly can allow partners come in and use our space. And if there's any of you on this call that want to be in one of the communities we serve, please reach out to our site coordinators, and we will try and get you on the calendar. Now, some hubs are bigger than others and have more space than the others, but we're happy to have partners come in because we know we can't do it all. And that's not what we were designed to do. Another really important part of this is trauma-informed care is you need to use personalized engagement strategies. So when you have a client who's coming in crisis, a 68-question assessment, like the RCI, the one we use, the Recovery Capital Index, is not going to be helpful. They're not going to be able to sit through it, especially if they're currently going through withdrawal, if they are just experiencing heavy cravings, if they are worried that they don't have a place to sleep tonight. So you really have to meet the person where they are. And sometimes what they define as a crisis is what you have to accept is their personal crisis. I find it interesting that we will have homeless individuals who will not identify their homelessness as the issue, but that they don't have medical care for their service animal. I have to meet them where they are, not where I think they should be. And that then becomes the basis of that relationship building. So that eventually we can get to having that conversation about you needing residential treatment, but I understand you need to make sure that your service animal is cared for while you're in treatment, either with you or in a foster situation. It's important that you do an assessment that reflects the person's needs. We use the Recovery Capital Index. I mentioned it. It measures and assesses individuals in 3 different areas, personal, social, and cultural capital. I'll talk about that more. Right now, I want to talk more about these personalized engagement strategies. It's important that you have an assessment that, again, reflects what that person needs and where they are in the moment. We then write up an individual recovery plan. I have used these tools in all kinds of different areas. They're called all different things in schools: individual education plan, IEP, family goal planning. There should be a system in place where the family identifies the goals, not the program. And this is really challenging because, let's be honest, we all have outcomes we have to report to whoever our funder is, whether it's the donor, whether it's government funding. We all have things that we have to report. So we still have to work on the person's goals, not ours. There also has to be accountability in play. This is an important part of recovery. I talked a little bit about that individual who would come in every day and say, I'm not ready for recovery. That did not mean that he could use this as a homeless drop-off, center, or that he could come in while he was intoxicated, or that he could come in, go have something to drink and come back in. No, there's accountability involved as well, both for the individual, but also for the organization. So this is kind of where we go in terms of recovery capital. I talked a little bit about personal, cultural, and social capital. These are the personal resources and community resources that we bring to bear. Outside of that, you also have, all of these personal aspects that really impact recovery capital. So it could be your housing, the risk for substance use, your physical health, your mental health. And then around that is really your sense of home, purpose, community, and help. So think of capital as a bank of resources that people have to draw on. So how do we measure this thing that's so intangible? Commonly developed a tool that allows us to do it. And they do have different levels of questions. The shortest one is 10 questions. The longest one is 68 questions. And it looks at 9 components across the 3 domains. And there's 22 different indicators. And that's a lot. And it really does also collect some extensive demographic information. And I will admit, it is hard sometimes for people to finish these, especially individuals in early recovery. I've had people struggle just to get through the demographics, but it is a tool that we have, and I just wanted to introduce it to you. So how are we doing in Palm Beach County? This is an aggregate of all the individuals that were evaluated by the Hub in all 4 sites. So it really is a look at Palm Beach County as a whole. Now, I will say it is heavily slated towards Delray, Lake Worth, Belle Glade, and Riviera because that's where our sites are. And it's historically weighted more towards South County because we have more historic data because we started, remember, first in Delray, then in Lake Worth. This does not measure individuals, and it also doesn't measure the success of the hubs because we work with so many communities and partners. So I can't say that because of the hub, there was this huge jump in February to June in personal capital, especially because between February and June, we introduced a lot more community partners and we opened a Riviera Beach office. Also, these scores are prone to seasonal differences. So we know that from national data that it's not unusual for personal, social, and cultural capital to start to drop off during the holidays. And really, a lot of times the low is in January. For us, the low was in February. But that is kind of a national trend that we see across the country. So real quick, I'm going to now talk about the Hub a little bit. I've spent a lot of time talking about, in general, resilient communities and recovery communities, but I just wanted to show you this cute little video.
Welcome to the Hub, a community for connection, growth, and recovery. This is a space to connect, grow, and be part of something meaningful. Come as you are, stay as long as you need, and grow at your own pace. At the Recovery Community Hub, you can connect with others and meet with a peer. You can attend groups and trainings, get help with resumes and interview skills, and explore housing options. Be part of a community and build a healthier future in recovery. This is not a program and not a requirement. This is your community. There is no wrong door, no judgment, and no pressure. Just real people and real connection for the whole recovery community. Talk to a peer. Peers are people with lived experience who understand the journey. They are here to listen, support, and walk beside you. We are here for you. The Hub is here for the entire recovery community. Everyone impacted by recovery is welcome. The Hub recovery community includes families, people working in recovery, provider organizations, community partners, volunteers, and advocates. Together, we create recovery-friendly communities. Our recovery community can help connect individuals and families to treatment and recovery services, mental health support, housing resources, employment readiness, legal and reentry support, and food and basic needs. You do not have to figure it out alone. If you are ready to take the next step forward, ask a peer to help you create your individual recovery plan. An IRP will help you set goals, build your path, and create your future. Start today, your journey matters. Remember, Small steps today can lead to big changes tomorrow. Ways for you to get involved include getting trained in Narcan to save lives and signing up for the Recovery Coach Academy. You can also give back by becoming a Friends of the Hub volunteer. Scan the QR code to explore events, trainings, and resources. Find monthly calendars for all 4 Hub locations, events, and activities at www.pbchub.org. If you believe in what the Hub is doing, please consider making a donation. Your support helps us continue providing recovery resources, peer support, and a safe place for connection. You can scan the QR code to donate.
All right. Thank you so much, Holly, for today's presentation. As we put on the chat already, if you guys have any questions, you feel free to unmute yourself and ask any questions, or put it in the chat. Yanni and Darcy are available to answer any questions. Ladies, feel free to unmute yourself, introduce yourself, or say anything that you feel like maybe Holly missed or wanted to say.
If anyone has any questions, we're currently and will always be working on building our community through the hubs.
So my name is Yana Lees. Everyone calls me Yanni. I am the court peer liaison here. So I work in the courts helping individuals and families that are justice impacted.
I'm Darcy Alvarez. I'm the program fidelity coordinator for the Hub Network. Fancy words for operations.
Why don't you guys tell us how you guys got involved with the Hub?
Holly actually touched on mine. So I started volunteering, became part of Lake Worth leadership team. I accepted a position to be the manager in Lake Worth, and now I'm the program fidelity coordinator. So we really do promote from within. We really do encourage people to come be part of the community, and the more time you spend there, the more you get involved.
My story is not as interesting. I got my peer certification, and then I applied to be the peer specialist. I was this peer specialist in Lake Worth, went up to site manager, and now I'm strictly working with our dealing of hope program. And we are working in the courts. It's a new program that we have to help individuals that are impacted and their families. We help with reunification, helping court costs be converted to community service hours, advocating for them in court. And yeah, we love working here.
And our next Eat, Learn, Safe will be August 18th, and that will be with the fire rescue.
Hi, Yanni and Darcy. It's Susan. So I love that you put in the link for, what's it called? Sober living? The Sober Curator. I just looked at that, and it really is a wealth of information for someone that wants to live a sober lifestyle and let you know you're not alone. And I just am adding it to our linkage to care, which is basically a database.
Your beach office, and that is the newest one.
I'm adding it to our linkage to care, which is a resource for people that are needing any kind of behavioral health services. So for the recovery end of it, I think it's an excellent resource to share, because it's kind of like a cheat sheet of ideas and links and resources that support a healthy lifestyle. So I thank you for sharing that. I thought that was great. And I love all the things that you all do that help the whole person. You know what I mean? Be a person. It's all about, identifying them in their own humanity to do that. And the presentation was excellent, and what you all do matters. So thank you.
Thank you.
I see Addis has a question. How did you guys listen to the community? What was that process? So we have multiple ways. We have the Recovery Capital Index survey. We also have surveys that we Hub participants can take, and we also have comment and suggestion boxes. There's also a section of someone's individualized recovery plan that says what they would like more of in their community. So there's many ways that we get that information. And we also bring that up to our monthly leadership. Each location has a leadership team, which are local people in the community who have some sort of relationship to recovery. At that monthly leadership team meetings, they review the comments and suggestions, they review the surveys, they review the Recovery Capital Index, and then they try to make suggestions and put programming in place for each location that honors the request from those people in that community.
I have a question. Do all of the Recovery Hub locations offer the same services? Do any of them focus in like different areas or?
So some community health partners that come to different hubs go to different locations because they have more resources available in that area. Some locations have a higher number of participants that are in need of healthcare services. So we partner with those community organizations and agencies that can come into the hubs and provide that. So each location is different. The
Depending on the need. Of the
yes,
community.
depending on the need or the request of the community. And if you go on our website, pbchub.org, there are calendars listed at the bottom, and you'll see that each location has a little bit of a different flavor to it.
And I put the website in the chat.
Thank you.
Again, thank you everyone for attending our webinar. The link to our certificate of attendance to receive that afterward has been added to the chat. So feel free to click on that. We also have a QR code that will be showing up here very soon. I know Amanda also included the link, the flyer for our next one, for our next webinar. And we also have our trauma-informed care training, which I know Susan added a link to that as well. For anyone who is interested, as you know, Holly also, talked a little bit about, trauma-informed care. And it is, again, a free training that the Palm Beach County Coalition is providing.
Thank you so much for having us, everyone.
Thank you, ladies.